right. Hello, everyone. My name is Sarah. I'm a junior board member at Miles4Hips. And today I have PT Megan Philipp here with me. She's PT who has personal patient experience. So we're going to go ahead and ask her a few questions after she introduces herself.
Hi, I'm Megan. I have been a PT for a little over actually almost 6 years now. And I had no idea that I had hip dysplasia until about 4 years into my actual PT career. Just like many COVID things happened, I actually found out that I had hip dysplasia during COVID after I tried to go back to running longer distances. So I had a labral repair in the beginning or at the end of 2021 on one side, so my left hip, and then after I went back to work after that surgery, I found out that I had the same thing happening on the right hip. And I actually had hip dysplasia as well. That was pretty significant. So I had a PAO in the beginning of 2022.
Nice. So, what led you to PT as a career?
So I've had multiple injuries throughout my years of like high school sports and just being active as a kid. And then come to find out later in life that makes me even want to be a PT even more is that I have a lot of hypermobility. My mom actually had hip dysplasia and ended up with a total hip later in life. So those kind of things just make me want to keep going being a PT, as well as I think just being able to help people and see people get benefit out of things that they're not sure about, or they're like, oh yeah, I definitely need surgery, and then they come to PT and like, oh no, actually this is really helpful. I think I can manage this on my own. Just other options besides pills and I guess going under to have surgery to fix things.
Yeah, I think that's a great point. I think a lot of times PT is kind of minimized as a valid form of like conservative treatment, and it's often pushed as like surgery and pills and stuff. So, great point. What's your favorite part of your job being a PT?
So I would have told you that my favorite part about PT before all of my hip journey would be like helping people, just basically the basics of like seeing people get better overall, whether it was an ankle, a back, a shoulder, whatever it might be. But now I think after being in the same shoes of like, oh, I'm a PT, but I'm also a patient, and having to go through a pretty significant surgery that I feel like most people underrate at some point when they hear about it, is the fact that I can have more of a personal aspect behind it. Like I understand what it means to have surgery. I understand what post-surgery pain is versus not understand how the recovery process goes. And I can kind of give like little tips and tricks of how to make other people's recovery easier based off my own personal experience.
Yeah, that's a great point. What can a physical therapist do for hip dysplasia? Is there anything that you specifically focus on in these patients?
I think that for me, I same thing kind of you evolve, right? As you learn to be a PT, as you see more people. But I think we have always thought that everyone has the same plan for PT. Oh, you're a hip, right? So we're gonna do clamshells, this, that, and the other thing. And then people wonder why like that person with hip dysplasia or hypermobility isn't getting better. So being really specific based off what the patient is feeling, based on what we find as like their personal issues, whether it be you don't have enough strength in this muscle versus that muscle, or like you're flexible, but you're a little bit too tight. So we need to do this, or you're too tight and we need to make you a little bit more flexible. So really making sure that I listen and direct my treatment towards that person, because sometimes it's like every time a patient comes in, it's something different, right? So I have to be able to incorporate what I want goal over wise for the things, but I also have to be able to change up my plan if they're coming in more symptomatic or something new is happening, or they're feeling something different.
Nice. I feel like also like your view and perspective as a patient can kind of help with that and really listening because you more maybe have like experience with that same pain and provide like outside suggestions that not everyone will have.
Yeah, I think before having a significant surgery, I feel like I understood people had pain, but it was like, oh yeah, like you have pain, let's keep going. And I think now more that I've had obviously experience with more pain and different aspects of that, I feel like instead of just going like, yes, we know you have pain, we acknowledge that pain and we deal with it, and however that might be, whether it's with an exercise, a movement pattern, mental strategies like go to your happy place is a figure of speech, but like figuring out how to work through it with the brain. I definitely find that that's more helpful and more, I guess, more personable. I don't know. I felt like even being a PT or a patient, people are like, oh yeah, you're hurting. I know, let's keep going, or like, let's do this. And they weren't really listening. So taking the time to step back, even if it takes me like 15 minutes to talk to a patient about, well, yes, you're having pain. This is why we know you're having pain. This is kind of how your pain works, like physiologically. And then what do you think we need to do to help that? And here's some ideas. What's your best choice? Do you think we need to focus more on a movement pattern, or do you think we need to focus more on like strategies to deal with it more psychologically?
Yeah, I think the psychological is definitely not talked about enough, and especially in regards in like the hip dysplasia community, it is so hard on the mind, and it's often not talked about how hard it can be to like live with the pain and undergo treatments and stuff.
Yeah, I think too it's interesting. Like the surgeon that I had, he actually made me like give a name of a psychologist when I had before I had surgery. Like I had to at least give them the awareness that I knew that I might need one, and I had to have one kind of lined up. But I think like we just forget it. I don't even know if we forget about it. I think we just, if you've never had it, right, you don't understand it. So the psychological part is a lot of like the in present part of that, and that's hard to do if you don't know what it is, but it's also hard to do when you're in it and you don't have anyone to reach out to. I think in that sense, just having like the communities that we have throughout hip dysplasia world, and then that same thing, like it's not a bad thing to have a psychologist just in case you need one for really any surgery. I mean, we talk about it with sports and return to sports. We have sports psychologists during those times. So I think it's something that we'll see more and more of.
Yeah. I'll be happy to see more and more of it. If comfortable, could you kind of explain your background and symptoms with your personal hip pain and the treatments you've had and how those went?
Yes. So I am not the greatest body awareness person. I've always been like that. I was always that weird kid on the softball field playing first base, and like, how did you get your limbs in that position? I'm like, I don't know, I just do it. So over the years, I've had different injuries, and I've presented with some like hypermobility stuff. And looking back on it, I can recognize it now, but back then I had no idea. I thought it was just normal. So I think the same thing kind of happened with like my hip stuff. I've always kind of been like, oh, I can't really squat, right? Like if I squat too much, my hips kind of ache, whatever. Or like everyone else can get really low, and I'm like, I can't get past 90. So thinking back that way. But then, like I said, COVID happened, and I didn't have anything to do. No one had anything to do. So I was like, oh, I can run because it's like nice. It's springtime, right? So I decided to start running again. And I had run half marathons in the past multiple times, and like had some hip pain, but you know, it's half marathons. You know, you're going to have some kind of aches and pains during that training time. But it got really bad to the point where I had a hard time like sitting and lifting up my leg. And that was mostly the left one to start with. So I did a little PT because that's what us PTs do. We try to use our own skills and people around us before we go any farther. And then this was to the point where it just wasn't, nothing was happening. It was staying the same, maybe getting a little bit worse. So then I went and saw a surgeon for like a hip specialist, just for labrums and stuff like that. Had some imaging, and then found out I had cams and labral tears on the left. Had surgery, and then kind of did the same thing on the right. However, the right was interesting because I could tell that the x-ray looked a little bit different than the left. And I had a hard time having anyone that was within the profession acknowledge that. So I went through many surgeons. I went through 4 different ones. I had a couple of injections in the joint. I did dry needling. I did learned my lesson. Wasn't chiropractor, didn't work very well. That made me a lot worse. Did PT again, and did anything I could pretty much think of while I tried to figure out someone that could give me an answer. So I ended up finding someone that could give me an answer, and then kind of had to sit with it for a while because I was kind of shocked. Didn't realize that I would be in the shoes of some of my patients, and that I would be on the other end and be like, oh yeah, you have 13 degrees of hip dysplasia. you can wait and have a total hip when it gets really bad and you have arthritis, or we can try to, mess with that now or fix that now into the sense that we can push off a total hip maybe forever or at least for quite a while longer. So then I had a PAO in 2022, and I'm a little bit over a year out, so it's been an interesting ride for sure.
Yeah, it is an interesting recovery from PO for sure. Lots of ups and downs that are kind of not talked about.
Yeah, for sure.
So as a physical therapist, you obviously have great knowledge of like anatomy and physiology. So did this affect how you went about finding a doctor and which treatment you preferred?
I mean, yeah, I definitely try to go more conservative first. But after the first couple of times of trying conservative treatment, I kind of knew that it wasn't going to work. So I did a lot of research. I saw a couple of different labral surgeons even before I knew about my right side and had my left side. I talked to a couple of different PAO surgeons, and then I just picked the one that was best for me, the one that I felt like was the one that was going to help me get back to what I wanted to do. So I think that that's the biggest thing that we forget about too, is that you do have options. You have the option to like find someone that matches you, right? You don't have to just go to one person. You can get multiple opinions and then pick the one that you feel most comfortable with. You can have a trial at conservative treatment, even if research says it might not work. You can, if it's doable, then you can always try it. And I think options are always important that we tell people without pushing them one way or the other, because we all have our bias, we all have our stories. So I try to really, now as a PT, I try to really lay out like, here's your options. These are kind of the things that you can try. These are things that you can do. But if I really stand that this is gonna end up in most likely some type of surgery, then I try to really like, hey, these are your options, but I'm just gonna tell you like, maybe you should go see a surgeon as well, just so you get an opinion. And then if you do need it and if the time comes and you're ready for it, then you have someone. So yeah, a lot of information in there, but definitely trying to really advocate now as a PT, like you have options to visit other people. You don't have to do one thing.
Yeah, I think options, like when you get the diagnosis, it's very much like, well, I'm the one who caught it, so like I can get you on my surgery schedule at this point. You kind of just feel rushed of like, I don't even know what this understands. Like, what does this mean for me? He says he can fix it. Like, there's not a lot of time to think, I feel like. And so,
Yeah, and like it's kind of a diagnosis where it's like could be life changing, right? I mean, it is life changing, but the degree of how life changing is, you don't really know until you have surgery, because we've seen all sorts of patients have all sorts of different outcomes in recovery and stuff like that. And so it's like, well, it is a life decision because there's a lot of unknown, right? On the other end, like you could have no complications, you could be fine, live your life, run as much as you want, do whatever you want, and then you could have, I mean, a whole host of from minor to more complicated to things that like debilitate you and don't let you do what you want to do. So it's a hard decision that I think requires a lot of options and research and figuring out who, like I said, is the best for you.
mhm. What do you think is the biggest myth about hip dysplasia treatment and or recovery?
Oh, so I think about hip dysplasia in general is like people think it's only in children, like as a baby, which yes, that's kind of like where we focused a lot of our early research and stuff like that, but it is not. You can develop it kind of as you go through life a little bit. They're doing more and more research about how sometimes, it can be affected in your tween years, not to get too much into that. But I also think that like people think it's like no big deal, right? They think it's the surgery itself is like, oh, I'm just gonna go in and fix your hip. It's like they go in and do things that we don't really recommend unless like you have a shell socket or you're in like a traumatic accident, right? So there are a lot of docs that are like trauma surgeons and they go in and fix what we have done intentionally, like a pelvic fracture or an acetabular fracture. And we're actually volunteering as PAO patients to have those things cut and turned and screwed back together. So it's not something to take lightly, but it's also like it's not just another surgery. I laugh because when I had my hospital stay where I was, the nursing staff was really funny because they always would say, oh yeah, those spine patients, they're always complaining, like those fusions, they're always complaining. They're like, you don't know why they're complaining. Like this is way worse than anything else that they could have done to their backs. And so I think it's funny that people are like, yeah, 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 it's fine. But it's like, no, 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 like you don't understand. It's like massive surgery. So
Yeah, I mean, just on my behalf, I had my PAO when I was just barely 16, I think. And I was so naive and I was like, yeah, whatever, they're gonna break my pelvis and, reshape it and rescrew it, whatever. Like I was just so gung-ho on getting back to what I wanted to do that I didn't really see it. And now reflecting 3 years later and have like another surgery, I'm like, oh my gosh, like that is like it is a major and intense surgery. And I would
yeah.
agree. I think a lot of people do think it's like, it's just like hip surgery, but it's like it is major.
I think too, like people don't think it can be like just wait for a total hip, right? Like it's not that bad if you're not like if you're able to move around, but it hurts, like just wait. And I think that's like detrimental to most individuals. Like think about if everyone who had a hip dysplasia just waited till they had a total hip. And let's say like you're 16, or I wasn't that old either. I was when I found out I had hip dysplasia, that I'd been there for who knows how long, right? Is I was 28. And they're like, if you don't do this, you most likely will end up with a total hip at 35. And I was like, well, because I'm PT, I'm like, so what happens like if I get a total hip and then that has to be revised? And like, well, like you're gonna have to get it revised. And then I was like, well, who's gonna want to do that? And they're like, well, that's kind of the point, right? Not a lot of people are comfortable with that. And it's a hard thing to do. You've already taken away a lot of the anatomy there. So it makes it a lot more challenging. So just like kind of tossing it off into the wind like it's no big deal, I think can be interesting to see if we ever do somehow find a way to kind of put that into numbers and see how many people had a disability or had some kind of life-changing movement or ability to move because we just said, yeah, just wait till you have a total hip.
Mhm. Yep. How has your experience as a patient influenced your work as a physical therapist?
I think just more compassion, more understanding, knowing the psychological standpoint of pain from actually being in it and recovery is different than what you learn in school. So the fact that I actually got to go through it, which when I was going through it, I was like, oh yeah, this is not the great, like I wasn't like, oh, this is a great opportunity to treat my patients better. But like coming out on the back end, like I have learned to do my own ways of managing with pain, which is not just like put some ice on it, take some Tylenol, but like sometimes movement is better to help certain pain levels. Sometimes we do have to kind of hone in our mental strategies to help us get through things because even though I've had a PAO, I still have small issues that are considered chronic pain that I still have to deal with. So, really using those strategies and understanding that kind of persistent pain for even people if it's only been like 2 months, because some people have never hurt before. And so, 2 months is a long time for them. So, teaching them, like, hey, this is kind of how all of this works, and here's what's helped me in the past. Has really changed how I treat people. I talk a lot more to people about just things in general like that than I ever have in the past. I mean, sometimes I'm like, oh crap, I have talked to them for 20 minutes about just one thing. We haven't done anything, right? So, I mean, that's not helping me, but also that's important. Like, if you don't know what your pain, how your pain works, and you don't know how your body works, how things function, and how movement helps, or this thing helps, or that thing helps, versus just like give me a pill and I'll take it and I'll be magically better. You're never gonna really fully understand like that. Not everything leads to surgery or medication or being depressed and living in a body that you feel like isn't gonna get better.
Yeah, I mean, I think it goes back to what you said earlier of they are also like a person. Like it is more than just a symptom and what's the quickest fix. It's fully understanding what's happening and how you can do, and it's gonna take work and time, but it's better in the long run to fully grasp what's happening.
Yeah, and I think too, like being in the situation where we know that not everything's going to be perfect, right? Because we know the severity of what this surgery entails and what recovery is like, and all the different things that could happen during that surgery. I think having that idea or that experience helps me point out to patients like you do realize like if you're not hurting a little bit, you're not living your life, right? Most people wake up with a one or two in some body part because they've been living their lives. They've been hiking, they've been running, they've been working. So not everything, we've kind of come up with this idea that everything should be a 0 to 10. And like that would be great, but that's not really how life works. We use our bodies, we do things, we enjoy life, and yes, we will get some aches and pains here and there.
Hmm. What research or knowledge would you like to see improve around the care for hip dysplasia patients?
I think the like long-term outcomes are starting to get there, right? Because we've had more and more consistency with that. But I think some like demographic stuff, even like a little more detailed on like pulling out like they just sent they actually there's an article that just came out about the lateral cutaneous nerve. So I still have issues with that nerve. And there hasn't really been a lot of research or even like case studies about it. And so there's an article that just came out. There's just kind of like a general overview of like what it is, right? Because it's educational. Like why is this and like where it is, and then like kind of why so many people have um various symptoms from it after just like a regular, it's not even a PA, it was after like a scope, right? So like stuff like that, like yes, we know that's a chance, but how many people actually get that complication, if you want to call it that? And then how can we better serve people who have that complication? So it was interesting because they talked a lot about like injections and dry needling and like conservative care versus going in and trying to breed, because a lot of people get it because they have scar tissue, but trying to breed. So like more things that we can treat the after effect, right? Because it's going into the unknown and then oh there it is, but sometimes we don't always know how to maybe not fix it but make it better. So I would really like to see kind of more stuff in the recovery side of things. Even in physical therapy, we don't have a lot of research on like what would be the best treatment method for it, or these patients with PAOs tend to respond better to these things or those things. So stuff like that.
Yeah, I agree. I mean, even on my end, I had my fair share of complications. And like you said, it was diving into the unknown and then it came up and then it was like a scramble of like, well, what can we do now? How do we go about this? So I think just overall, like you said, just more knowledge about the recovery, know what you're getting into. Because
Yeah, I think we can be a little more specific too, right? Like now that it's becoming a little bit more common, we have more kind of longish term outcomes and we kind of know where people sit at like a couple years out and then a little bit farther, and then kind of where we start to get into the like 50-50 of you're still PAO with no conversion to total hips. I mean, just trying to help people like in those in-betweens, right? Because I don't know, like my surgeon's like, yeah, you're gonna come see me every other year for the rest of your life. And I was like, wait, what? Like I have to keep coming to see you? And then it like some of that might be because of research, right? But I'm like, that's a fair point too, because I mean, who knows what's gonna happen in 5 years? Is it gonna flare something up? Is something like it's gonna happen? And so having that kind of like in between, I think would be really helpful to like patients, but to us as professionals as well.
Mhm. So, as a PT and now patient, what would be your biggest piece of advice to someone who just received a diagnosis of hip dysplasia or is going under PAO or any other type of surgery?
So probably the biggest piece of advice is do your research with credible places. We have lots of good communities within the PA world that are supportive, but not research based or professional based or have medical things. So like really finding resources where you can get information that you can trust. And there's some good ones out there. Miles4Hips is a great one because you can get attached to everything else. But in addition to that, I would say like do your research on who you go to see for recovery, right? Find someone that has at least hopefully treated a couple of PAOs, or if they have not, they are able to have the personality where they'll go do research for you and then come back and like, here's what I found. These are the things that I think professionally would help for you. Let's try them and see if they work. And if not, they're willing to kind of redirect their treatment. Because it's hard sometimes to find that like piece where even if they don't quite know exactly what PAOs are or how recovery goes, but they have the willingness to help you no matter like how much time they have to put into it.
Hmm. Yeah, I think research, that's the biggest thing is it's so often patients that have hip dysplasia kind of get all these diagnoses thrown at once. And it's if like I know I found it really hard to navigate. I was only 13 at the time and just finding like those communities and the people that will do it for you and put in that extra work to make sure you're not necessarily making the right choices, but making what's best for you. And I would have to agree.
Yeah, I mean, I didn't schedule. I knew I had needed a PAO on the right side in August of 2021 or yeah, 2021. And I didn't schedule my PAO until like December and I didn't have it until February because I was like, I know some because I was educated a lot in school on it because of where I went to school, but I didn't feel like I knew enough and if that was the best choice. So it took me like 5 months to even say yes.
Hmm. Yeah. Well, thank you so much for joining us today. I think your perspective is just so unique, and people who watch this interview are going to be so appreciative. And I think all your patients are probably very appreciative. I know the little bit I was a patient of yours, I was very appreciative of everything you did for me. So just thank you again for joining us.
Yeah, thank you for having me. It was good to talk with you.